Hi there and welcome back. I'm Meaghan Selki, your host and International Board Certified Lactation Consultant here at The Milk Production. And today we are going to be talking about plugged ducts and mastitis. Specifically, we're going to break down what's actually happening when the breast gets sore or inflamed, what the difference is between a plugged duct and mastitis, and what the newest research says about how to treat these. It's helpful to think of plugged ducts and mastitis on a spectrum as opposed to two separate things. Both, we theorize, are related to inflammation. I say that we suspect or theorize this because we don't actually know the exact cause of either plugged ducts or mastitis. But one of the theories is that there is inflammation in the duct that is causing narrowing that then leads to a potential blockage and milk stasis where the milk is not able to empty from that part of the breast. Plugged ducts can evolve into mastitis, which is where you're starting to see those systemic cues like headache, flu-like symptoms, fever, achiness, that kind of thing. And this is a change from how we previously talked about and treated these things. But what you'll notice in both cases is that inflammation is the root cause. And as such, that means we both talk about and treat these things differently than we did in the past. In November 2022, the Academy of Breastfeeding Medicine Protocol number 36 reframed plugged ducts and mastitis on this continuum of inflammation. And a key takeaway from those updates is that we want to view even mastitis as not an infection until proven otherwise. Proven otherwise typically means that your symptoms of mastitis are lasting and not improving for 24 hours. At which point the recommendation is to go ahead and seek treatment in the form of antibiotics. We were previously having women reach out to their primary care providers or their OB if they got any indication that mastitis was occurring, and then to immediately call in or be seen to get a prescription for antibiotics that they could take to resolve the infection. In doing so, we were likely overusing antibiotics, which contributes to the development and propagation of superbugs. It can also have side effects on moms, decolonizing good gut bacteria in combination with the bad bacteria it's trying to get rid of. While safe for breastfeeding, some of these antibiotics do transmit into the milk and can potentially have side effects for baby as well. So minimizing those side effects both for mom and baby by seeing what mastitis will do and how it will take its own course when given time to resolve is now considered the standard of care and the best practice that we should be doing. So if you're now, there's two caveats that I bring up with respect to that approach. The first is if you have a history of recurring mastitis and you know that, okay, I get mastitis and it does not resolve on its own and I have continually had to get antibiotics, then there's not necessarily a benefit to waiting to see if it resolves on its own. If you want to, wait the 24 hours, you're welcome to, and then seek treatment after that. However, this gets to my second caveat. I do not like sending moms home on a Friday afternoon when we're maybe 5 hours into symptoms without a plan of care for how we might address that if the symptoms are not improving over the weekend. The reason for that is because I have seen, as we talk about this spectrum, plugged duct turn into mastitis, turn into an abscess, which escalates very quickly once it gets to that point and needs treatment very urgently in an emergency setting, typically in conjunction with continued lactation support. And a lot of times when you go to a place like urgent care, for example, many well-intended recommendations from urgent care centers trying to help moms resolve these symptoms of infection have made it such that moms are actually decreasing milk removal by either not breastfeeding as frequently or not pumping as frequently. In those cases, it can actually worsen the inflammation and the milk stasis and the further development of mastitis and potentially into an abscess. And not all urgent care providers are this way. And I don't fault those who don't necessarily have lactation knowledge about what to do, but that's why it's so important as a mom and a patient who is lactating to know that you may need to seek out multiple points of perspective and advice in different instances, and this is definitely one of those. So if you find yourself on a Friday going into a weekend and it has not been 24 hours of mastitis symptoms, I would encourage you to reach out to someone as part of your normal care team, someone who is typically treating you in the context of the dyad that you currently are. And when you're breastfeeding, you are breastfeeding parent and the nursing baby. And those two should be treated one and the same, because what we do to mom can impact baby. What we do to baby can impact mom. And so when we arrive at an urgent care setting with symptoms of an infection, they may not have that context, and you may not be getting the full scope of care that you really need in those situations. Now, most cases of mastitis aren't evolving into an abscess, but because that can happen, I take it very seriously, particularly on Friday, because it's harder to get a hold of your typical care providers going into the weekend. Making sure that mom has a plan of care, reaching out to your provider on Friday evening and saying, I know we typically wait 24 hours now to treat mastitis. However, could you put the order in for the antibiotic? And if it gets to the point where it's 24 hours on Saturday evening, then I'll go ahead and run over to the drugstore and pick up the prescription. In which case, you've got it ready, lined up, and you're still working with people who are very familiar with your situation, the fact that you just had a baby, that you're nursing. I think that can be a good approach when you're sitting there on a Friday with symptoms. As a reminder, what we're talking about is local inflammation. What we can see is a plugged duct could be inflammation in the duct itself that is decreasing the ability for the milk to flow through, and that's why there's increased issues like milk stasis, where the milk's not moving out. In the case of mastitis, we're talking about an inflammatory basis for that mastitis. Now, there are bacterial infections that present as mastitis, but those are, in fact, less common. The way that we talk about this really does matter because it affects how we treat it. Remembering that antibiotics don't have to come first, that we should really be addressing the inflammation and the milk stasis, helps keep us on track and on target for what we need to do to improve mom's symptoms as quickly as possible. So let's talk about what's actually happening with plugged ducts. These can be common around the first through the third weeks postpartum, especially after a long stretch of sleep, potentially skipped feeds, restricting bras, tight bras, or a sudden decrease in feeding or milk removal frequency. If you were pumping 8 times a day and you went down to 7, that could be a decrease in frequency. If you were breastfeeding 8-10 times a day and then baby starts sleeping a longer stretch at night, that could be that decreased frequency that could lead to this. The way that this evolves is you get a local milk stasis where the milk is not coming out of the breast, and that pressure in the duct is increasing. The inflammation then sets in, and the duct itself narrows so the milk is not able to flow through as freely. That presents as a localized lump that you might be able to feel. Maybe it's the size of a pea, maybe it's bigger, maybe it starts small and it gets larger. Sometimes there's some soreness or tenderness to the touch, but you're not feeling anything in your whole body. When you are at this point, gentle but frequent feeding is going to help remove that clog or plugged duct. You don't want to do any aggressive massage, which can actually worsen any tissue trauma that's happening from the inflammation. I have seen moms on occasion really trying to work out a clog and they're massaging the breast so hard that they bruise their skin. That's not helpful. It's bringing additional blood and lymph fluid to the area that is also impeding the ability for the milk to flow freely in the ducts. Another really important thing to remember is those massage tools can be a little bit more aggressive than you might do with your own hand. And the warmth or the heat on the breast is particularly important to remember that that's best only right before the feed or the pumping session. Really, in between pumping sessions and for the majority of the time, except right before the feed is starting, a cold compress, a bag of peas, pack of ice or something like that, that's what's really best to decrease inflammation in that area. Warmth is going to feel more soothing typically. So when you imagine getting in a warm shower, the warm water is running down on you, a lot of times that feels very comfortable for moms who are having engorgement or inflammation due to a clogged duct. However, it's also going to bring, again, more circulation, more blood flow, more lymph fluid to the area. And it's also going to encourage more milk production than may be necessary and can exacerbate the symptoms of milk stasis and prevent the ability for that milk to flow freely. So again, use warm compresses or anything like that only right before the feed. In doing so, you can help the milk let down, which can help baby latch on and eat vigorously. So it's not off the table. You just want to be very judicious about when you're using the warmth and massage. The other thing you want to check is how baby's actually latching onto the breast. So look for mechanical issues. Are the lips flanged out? Is baby latching deeply or is it shallow? Does your nipple look compressed when baby comes off the breast? That could mean that baby's not latching deeply enough and is trying to transfer as much milk as they can, but is not able to remove milk effectively because of that compression of the nipple. Baby's latch and positioning is very important, but typically you'll see other indications that those things aren't quite right if that's the issue. In addition, if you're pumping, the pump flange size can matter. How the flange is fitting, how comfortable the pump is feeling. If you're experiencing pain or pinching on the areola or rubbing on the nipple or areola, all of these types of things can indicate something's going on with pumping, in which case you would also want to troubleshoot that to make sure that you're getting your pumping routine and rhythm down so that it's not causing any issues in terms of milk removal. Think of it like traffic in your milk ducts. Backed up milk causes pressure and inflammation, not necessarily infection. So should you massage out a plugged duct? Not hard. Deep massage can actually make inflammation worse. Gentle movement and milk removal are what help, not bruising the tissue. One of my former coworkers used to say the best thing about gentle movement of the breast. She said you should be doing a daily milk shake. And that she recommended leaning forward, moving the breast all around in that position. When you're even standing up or laying back, there's a thing called breast gymnastics. You basically move the breast in all different directions. And what you're doing is ideally increasing the flow of the milk in the ducts just by doing that. So that's sort of daily maintenance that you can do the milkshake every day. But if you've not been doing that and you've reached the point where you do have a plugged duct or mastitis, you can still start doing that and see some benefit. I've even seen some awesome things where you use KT tape and you tape your breast a certain way to be supported more up into a position where the lymph fluid can flow more easily, which can also help decrease the inflammation. Remember, warm right before a feed or pumping session, cool after, and all the way through the period in between feeds. Heat helps get milk moving, but cold calms inflammation once baby's done feeding. So let's talk about when plugged ducts become mastitis. When local inflammation triggers systemic symptoms such as fever, chills, body aches, fatigue, headache, it's moved toward mastitis. Remember, not all mastitis is infectious. Academy of Breastfeeding Medicine's protocol number 36 emphasizes that most early cases are inflammatory, not bacterial. If symptoms persist beyond 24 hours or worsen, professional evaluation is needed. Warning signs to escalate might include a high fever of greater than 101 degrees, worsening pain, sometimes red streaking on the breast, and flu-like feelings. For plugged ducts and mastitis, fever doesn't always mean infection. In the Academy of Breastfeeding Medicine guidelines, early mastitis is usually inflammatory, so the first step is reducing swelling and keeping milk moving, not automatically starting antibiotics. While we're on the subject of the Academy of Breastfeeding Medicine's protocol number 36, which you've heard me mention, we're going to talk about what changed and why it matters. In November 2022, the Academy of Breastfeeding Medicine overhauled some old approaches. The emphasis is now on inflammation first and infection second, because we're seeing that mastitis is typically inflammatory first. The protocol really discourages overuse of antibiotics due to resistant strains and gut microbiome impacts. The guidelines advocate for addressing underlying milk stasis and inflammation with things like ibuprofen, ensuring that the milk removal, whether it's breastfeeding or pumping, is effective and efficient, and teaching and practicing gentle lymphatic drainage. The level of evidence for this protocol is of moderate quality. Many recommendations are based on clinical consensus due to limited randomized control trials, which are typically the gold standard that we try to utilize when making these recommendations. Unfortunately, there isn't a lot of research in this area. Something I find frustrating, and if I do, I know it's frustrating for you if you're going through this, is the difference between practitioners and what they recommend regarding plug ducts, mastitis, and treatment for those things. Some resistance remains among clinicians that were trained under previous models of how to treat those conditions. There has definitely been a slower uptake regarding this protocol, especially in hospital discharge instructions. So be mindful of that if the guidance that you've received conflicts with this updated protocol. That's why parent education on this topic is so very important to me. You can learn to recognize these signs early and act quickly, even if your provider hasn't seen the new protocol. Let's talk about prevention and potentially some early recovery strategies that you could use. First and foremost, we want to make sure that you maintain regular, comfortable milk removal. Don't overpump just in case. Avoid pressure on your breasts in the form of tight bras, too tight baby carriers, side lying for too long with compression on the breast. Also, learn about lymphatic massage. We want to support lymphatic flow with light sweeping motions toward the armpit and clavicle. We have the most ducts in our breast on the upper and outer parts of our breast. We have milk ducts on the underside and the inside as well, but we have the most on the upper and outer parts of the breast. And as such, when we talk about lymphatic drainage, what we really want to do is drain the lymphatic fluid to assist in cases of milk stasis, plug ducts, and mastitis. And so the two areas that you want to be making sure that you're massaging toward is up toward the clavicle, because you've got lymph nodes here, and then up into the armpit. So on this side of the breast, going up into the armpit, because you have lymph nodes here as well. Hydration is also really important, as is rest for you. Balanced nutrition, anti-inflammatory foods can also help recovery. The protocol also mentions using soy or sunflower lecithin daily to decrease inflammation and emulsify milk. However, the evidence on that is limited, so beware of that before you start that supplement. If symptoms are worsening, or there's a high fever or recurrent issues, it's definitely time to call in professional help. You can connect with a lactation consultant who might be able to troubleshoot any milk removal issues or identify whether this is a case of plugged ducts or mastitis or where you are on that continuum. And you can also reach out to your OB who should be able to help you identify where you are on that spectrum as well and help you come up with a plan of care. Your breasts aren't fragile. They just need good circulation and consistent emptying. The best way to prevent mastitis isn't endless pumping. It's balance. Feed or express regularly, but don't overdo it. Consistency keeps inflammation away. If pain, redness, or fever lasts more than a day, don't wait it out. Early help means faster recovery, and you'll feel better feeding your baby. So here's the takeaway. Plugged ducts and mastitis aren't two separate enemies. They're part of one spectrum. When you act early and you keep the milk flowing, decrease inflammation, and get rest, you can stop that soreness from turning into an infection. If you're not sure whether what you're feeling is a plug or mastitis, or if you've already tried everything and it's not improving, don't wait. Schedule an appointment with your lactation consultant or your OB to get the care you need. And that about wraps up this week's podcast. Thank you so much for joining. I hope you found this resource helpful in understanding what plugged ducts and mastitis are, how we treat them, and how you might be able to prevent yourself from getting them. If you haven't yet, please follow us on Instagram, Facebook, YouTube, Spotify, wherever you get your podcasts, all at The Milk Production. And remember, we always pull together detailed show notes and post those over at themilkproduction.com. Thanks again for joining, and I look forward to seeing you next week.
The Milk Production.